it's a very interesting case. It was the very earliest case when I took Ganoderma for promotion. It has happened in my own family. My wife's maternal uncle, my wife's maternal uncle's wife, she was afflicted with cancer. She had a cancer of the spinal cord, and she was a diabetic as well. But to look at that lady, she is like a lemon. She is so beautiful. She has got long hairs. It's a very nice lady. To look at, she is very, very pleasing. But unfortunately, this lady got into this trouble. So she had to be admitted in a hospital and all that. And she was in the hospital undergoing a harrowing treatment. And she was in the bed for long, so she developed bed sores and all that. That is the time I visited her. Then I suggested about Ganoderma. Anyway, you are taking too much of treatment now. No problem, you continue your treatment, whatever, but take Ganoderma along with that. But then, I am the son-in-law of the family. You know the case of son-in-law situation. So they say, what, Rathnam, these days he is talking mushroom, he has become a mad fellow, like that, Somebody said, no, don't recommend it. I said, okay. See, I can give you an argument, but I cannot give you an understanding. I can give an argument, but I cannot give you understanding is to be done by you. So, what I can do? So I left it. But later what happened? The hospital themselves, they discharged her, saying that she may not live for more than 6 months. So she had to be transferred back home. But there is nobody to do another nursing for her in the home. So they transferred to another hospital. And in that hospital, there is one doctor who had come and told this patient, such type of people were terminally ill people, were cancer, final stage and all that. I am giving a product like this. Okay, she showed 30 packs of Ganoderma, RGGL. She was having in your bag. The doctor is using, I believe. I don't know who has recommended. I didn't recommend to the doctor. But luckily for that lady, my wife was there that day in the hospital. So my wife said, this is the same product my husband recommended to you 6 months ago. Then they understood, oh, this is something different. So you always require third-party endorsement, not a family man endorsement. That's why it happens. Family people, they don't accept this. It's outsiders, they accept better. So they immediately went helter and skelter. They wanted to get this product. They started using. Then they called me up for the dosing and all that. First I asked them to take the diet therapy. After that they reduced the dose. Now this happened in the year 2000. The time given for the lady to take ticket was only 6 months. But today is 2011. The lady is fully alive. She stopped all the steroid treatment. She stopped all the anti-cancer treatment. Her diabetes is under control. Maybe she had not got her entire hair because it was quite a big one, but now it is doing some pop cutting and all that. But she got back her entire color back. It is amazing. It has infused tremendous amount of confidence in me as well as in my family members. After that, there are so many family members who have started taking this product, not for cancer, but of course for not getting cancer or for any other ailment as well. The other case where a group of doctors got convinced is a diabetic gangrene case. In Bangalore, in one hospital, there was a lady admitted, and one doctor who is an ENT surgeon, this was the very earliest case for me, and the ENT surgeon was treating this patient. It's a severe diabetic case, and she had a non-healing foot ulcer, developed gangrene. So the next course of treatment is only amputation. And that is the time we recommended to through another doctor friend, we got into connection with this doctor. What we recommended was take Ganoderma 4 pairs, 2 RGGL morning, 2 RGGL in the evening, and cleanse the wound with saline and all that. Then use RG powder as a topical usage, topical application, 2 times, morning and evening dressing. In 3 months' time, we have photographed that also. In 3 months' time, there was a complete healing, 100% healing. And that has convinced the doctors inside that hospital, the ENT surgeon. And after that, there is one gynecologist who has taken, her father had psoriasis, for a long time psoriasis person, and that person's psoriasis got relieved. Well, so many people, because that is the beginning of our doctors getting convinced of this product. So, like this, now today, if you ask me, there is a long list of testimonials we can say like that. People who have had, I know one person, one lady who had a kidney, dialysis going on. 3 times a week dialysis has now been reduced 1 time for 15 days. 1 time for 15 days. Now somebody asked me a question. No, it has not become zero, no, doctor. See, it is very easy to ask a question like this. But a person who undergoes dialysis 3 times a week only can appreciate that she is undergoing only once in 15 days, what an amount of change and relief the person gets it. That's a very great thing that has happened. And in this, I would also like to mention, sometimes what happens, we go and talk about cures. We say Ganoderma is a cure. Many people promote this as a cure for many diseases. Actually, in my view, it should not be done like this. The reason is, what do you mean by cure? What is the meaning of cure? Cure means you should not get it back again. That is what is called a cure. Correct, no? Right. Now let us look at like this. I had appendix problem. I had appendicitis. So I go to a doctor. So doctor does an operation. So he removes the appendix organ. He throws off. So I will not get appendicitis in future because the organ is thrown out. 100% cure. Next time I went to a doctor with an asthma problem. Severe asthma. So doctor wanted to treat me. Doctor, before you treat me, you should give me 100% cure. No, how? No, last time I came, no doctor. Appendix operation. So you cut off the appendix organ and threw it out. So I must also get a 100% cure for my lungs problem. So do you think that doctor will remove the lung and the heart and give it to you, put it in a showcase and see? So where is the cure? Oh, if it is so, that what doctors are doing? Doctors are doing relief. 99% of the problem is relief, not cure. Supposing a lady has got multiple fibroids becoming malignant in her uterus, then the doctors removed it by hysterectomy operation. By hysterectomy, you remove the uterus and throw it off. So you will not get into this type of problem again. That is a cure, 100%. Now supposing I have a problem in my stomach. Now I can give you 100% cure by removing and throwing your stomach. Then what will happen to me? So these are all certain terminologies. We must be careful enough in using it. When you use Ganoderma, it gives you a lot of relief. You talk about that, then it gives a lot of confidence. So don't go and talk to your doctor. Doctor, I'll tell you, what doctor you are. You are treating same fellow for 20 years. No, I give you one, remove and prevent, RG and GL. It cures everything. The doctor will not accept it. This is where our problem is. We must be simple. We should not be over enthusiastic in talking about that. So you talk more of relief rather than of cure.